Welcome to Hatching Creativity. This isn't just another behavioral health podcast. This is the place where thought leaders converge to talk about real-life challenges, breakthroughs, and pivotal aha moments. Hey everybody, thanks for joining us today. I'm really excited for today's guest, Heather Baker from Prosperity Eating Disorders in Virginia. This is a topic that I've wanted to discuss since we started Hatching Creativity, and I'm really excited to have Heather here to talk about this with us. Heather, could you give a brief introduction about yourself and Prosperity Eating Disorders?
Sure. I am a social worker, a licensed clinical social worker. And about 15 years ago, I started working with people with eating disorders. I was the only one in Northern Virginia that actually was treating eating disorders. And it was just a desert here. So I joined up with a family therapist and a dietitian, and we started treating children and teens and their families in this area. And over the course of the last 15 years, we've developed a day treatment program, an evening program, 2 different treatment centers throughout Virginia, and we've helped thousands of people from 10 years up to older adults, all types of eating disorders.
Great, thank you. Do you have people coming from other areas of the country to see you guys as well?
We do. There's a lot of good programs out west, specifically Arizona, and they will send them to us and they will get an Airbnb or a hotel. Our day program usually is between 6 and 12 weeks, so it's a big commitment. And I would say just locally, within an hour and a half drive, they'll come every day.
Excellent. One of the things I would love to get started on today, though, is talking about adolescent care, because a lot of us have kids, and when you do have a kid that is struggling, we don't always know what to do as parents. So I'd love to dig into this a little bit on the adolescent side. And from your experience in the years that you've been doing this, Heather, is there a specific age or a certain age range that you find that eating disorders tend to start?
So this will surprise you, but the ages of 10 to 12 is when I see kind of things are starting to sprout up. And it usually starts with body image. And so for females, this is typically when they're starting to develop, they're going through puberty, and their body's changing, and they're noticing they have women parts when they've been a kid.
Right.
And there's that transition that can be really scary, that their body is not in their control. If they develop too early, they typically get called out for it or made fun of because you look different than the other girls. And some girls grow out before they grow up and will get teased for being chubby. And also a lot of times parents are like, oh, my daughter's getting a little bit chubby. I need to let her know to watch the sweets and watch the snacking. And so comments start to get made, or maybe you should go out and work out more. So the seeds kind of start to get planted. And that's just one course that could develop an eating disorder. But typically with the teenagers I work with, when I say, when did you first start thinking about your body and not liking your body? And most often they say between 10 and 12.
And this is probably going to be a question that you get all the time, but are you seeing that social media has a big impact on that?
Yeah, it's interesting because I think for older adults who I work with, their eating started maybe more towards late teens, early college. And then it's just kind of kept getting earlier and earlier. And that could be because, say, I'm in my 40s, my generation, we didn't have social media. We had the supermodels maybe to compare ourselves to, but it wasn't always for body image necessarily or social media. But now that we've kind of experienced that and have allowed our kids to experience that, they're getting information earlier that's a little more adult for them to really understand. Like their logic might not be totally make sense. Like as a 10-year-old watching an ad for an adult, right? Or watching older teenagers struggle and they're a child. So things start to get planted. In addition to kind of my generation, there's always been diets. right? There's
Right.
carb-free diet, there's all carb diet, there was Atkins, now it's keto. Like the diets just keep changing names. And so maybe it's our kids that are watching their grandparents and their parents dieting and talking about their body and dieting. And so that's more normal for them to see that.
Sure.
But again, it's not all the time. It's parents are usually often not to blame, where it used to be that it was always the mom's fault. And they've realized that that's not the case for many people.
It's not just restrictive or eating or purging. You're seeing a lot of that. And then at the same time, you're seeing social media about I'm big and I'm proud, and you potentially are pushing people to be unhealthy with that too. Have you come across things like that too?
Well, so in the eating disorder world, we don't believe obesity is an eating disorder.
Okay.
So obesity is not the same as like anorexia or bulimia. Obesity is typically considered a medical condition characterized by excessive body fat. This may be genetic, environmental, behavioral, psychological, right? So the obesity is the medical issue where you can be in an eating disorder where you can be in a bigger body and be healthy,
Right.
right? But it's assumed that the average man or woman who goes into a doctor in a bigger body, the number one thing a doctor is going to tell them is to lose weight. And they might be coming in for a cold or an infection, but that will be the treatment. And so
there's judgment with that as well,
100%,
which also is going to make people potentially swing the other direction.
100%. And also if you're going to the doctors for being shamed. So we're all made with different body types.
With that said, it's pretty interesting because I go to the doctor and I'm pretty lean, and I go to the doctor and my body mass, they use the BMI, right? And the BMI tool will tell somebody that they're obese, even if they're not, which will also create issues. It's created issues for me. I could tell you for sure, for somebody who may be going into a medical office and having issues like that. I mean, what are they doing? Are they coming up with something other than a BMI?
Do you know where the BMI was created? By a Belgian astronomer.
Interesting.
Yeah.
So for those of you who are listening, if you're listening to this and don't know what BMI is, the body mass index, and that's where they look at people's height and their weight and tell you whether or not where you are on that scale, and use that to determine obesity. Sorry, Heather, I didn't mean to cut you off. I just wanted to make sure people understood.
So it was created in the 19th century. He wanted to find a way of quantifying the degree in different populations of obesity. And so his sample was a man's body, a normal weight man's body. And so his calculations were based on that. Like, this is the standard, which also doesn't make sense for a woman to be in that exact same quotient, right? Or somebody who's a bodybuilder, right? So a bodybuilder who's just eating his chicken and his rice and, he's going to have a very high BMI, right? So he would be considered in the obesity category, right?
Pretty interesting, right?
Yeah. So you can have somebody in a normal body that's got more muscle that will be then told, well, you need to lose weight because your BMI is too high. It also doesn't take into account children. Children's BMI is going to, you can still be 6 feet tall and 13 years old. You can't equate that to an adult male or adult female, right? So it doesn't take into any of those factors. But insurance uses that to determine whether you're going to get care or not in the eating disorder field. Somebody is sick, and let's say they're bulimic or they're binge eater, but they're still in what's considered a normal body. A lot of times they will be not considered medically, it might not be medically necessary for them to be in treatment because their BMI is okay. Well, we know that there's greater problems with people who are bulimics than sometimes anorexics because of the purging, because of the restrictions, electrolytes. There's so many things. So what happens if you go to treatment for anorexia or any other eating disorder, as soon as your weight gets to a place that insurance says, well, this is the BMI, you're healthy now, they're immediately kicked out of treatment.
Really?
And so a lot of people with eating disorders have gotten this thing of like, well, I must not be sick enough to get help. So there's shame around that.
how would somebody look at themselves and say, I think I'm at risk for an eating disorder. Maybe I have an eating disorder, or as a parent to look at their children and to say, is there a potential eating disorder here? Obviously, by what you're saying, this BMI is not the way that people should be gauging that. How should people be looking at it?
We don't even really look at that. We have to send it for insurances to get treatment. Insurance won't pay for it unless they have those numbers. I think we first look at some of the behaviors, what is different from how they used to be. So for anorexics and bingers and bulimics, they all restrict their food. They all start from restriction. What happens next depends. If you see your child, your teenager wanting to be healthier and start cutting back things, this is usually the first sign. And parents always say, I didn't know. Well, because I just thought she was being healthier. I thought it was good that she was cutting out some sweets. So that's typically one change that you start to see. And then it gets more and more, and they cut out more food groups. They cut out meals. You start to see that and you're concerned, like, oh, maybe it's just a phase. Maybe they'll grow out of it. Still nothing is said. So it's typically when they go to the doctor and the doctor's like, wow, you've lost 20 pounds this year. That's significant. You weren't overweight to begin with, right? So no teenager or child should be losing weight because their bodies are always still growing. So when you restrict, you're taking away energy from your body to grow and develop, even if your body is bigger than your peers, right? We should never diet. And so I think it's gotten too common to allow our teenagers and young children to eat healthy or follow these special diets because it's extremely risky. For one huge group of people, eating disorders are genetic, right? Just like schizophrenia is, just like alcoholism is, you have this biological piece. What happens is when somebody starts to diet and they've lost a certain amount of weight, their chemicals change in their brain, and then something clicks in their brain and it doesn't click back. So they become more obsessive. They become more focused. As they continue to lose weight, there's more anxiousness, there's more depression. And your brain is just telling you that it's your body's problem and your body can fix it, right?
Do you find that, so like for substance use disorder and a lot of other kind of disordered behaviors, right? We see that you're at a higher risk if you've suffered trauma as a child. Is that something as a parent maybe to kind of be cognizant of as well, that if your child has been through that maybe that could potentially be a factor there?
I don't know the latest research. It used to be 50% of people who had an eating disorder also had trauma. And I think we used to think of trauma as more of we call big T trauma, being raped, molested, war, things like that. What we're finding now is, and you love to talk about attachment, is when certain traumas happen, it affects how we see ourselves, our safety, our protection. Being bullied, I would say 8 out of 10 of the clients in my program have been bullied. A lot of them have some level of autism, Asperger's. They have a hard time connecting socially. So maybe if I'm thinner, maybe then I can fit in. So a lot of, poor social skills. So I can control my body, but I can't control my personality or my social skills. And again, nobody chooses. You can't choose to have an eating disorder. I mean, half the world can diet and nothing happens. They don't develop one. And then a certain population, if they diet, they lose some weight, their brain changes.
Yeah, this is really helpful for parents to be looking at some of these factors, and kind of as a parent also looking at the way we're talking to our kids about ourselves and about other people as well. Sometimes you hear people make comments or judging other people, things like that. Kids always hear that stuff. That's definitely a thing that we want to be careful of as parents.
Well, say you have the trauma and you have the genetic and you start to lose some weight, because I'm just going to take out some things in my diet. When you start to lose weight, how many times is somebody going to say to you, wow, you look great. Have you lost weight?
Yep.
And then boom, okay, that feels good. I can keep doing that. And it becomes addictive.
Then it becomes, how much can I get down to? When you start looking to the scale, you start to look at those things and go, if I look this good at this, what's going to happen if I'm down to X amount of pounds? Then it really just becomes a challenge for some control over that.
The most common eating disorder is actually binge eating. where most people, when they think of an eating disorder, they think anorexia.
So
So
how would you define binge eating? Maybe for people who are not familiar with the term or haven't really given it thought.
So the most
What
common
warning
answer I
signs would
get
you
from
see?
people when I bring it up is, well, I could never have an eating disorder. I love food too much. And I usually just want to say something or do something when they say that, because people with eating disorders like food. It's not like their taste buds are different, but there's a fear around food. There's shame around food. It might feel sinful in some way, and then you got to repent in some way, right? So with binge eating, it always starts with restriction. I'm not going to eat much today. I might not eat at all today, but then I get home and they've either planned it, it's either not planned, but they feel out of control, where they start to eat and they can't stop eating, even if they wanted to. And they don't stop eating, even if they feel full. And over time, they have lost the ability to feel full or feel hunger, right? They know when to stop and they actually feel sick. So some people will tell me, this is the only thing I get to look forward to. This is the
Hmm.
only like bright spot in my life is this food, and they have this relationship with food, and it calms them down or it gives them some pleasure, right? But then the next day I feel so guilty and I feel kind of sick, and so I'm not going to eat today.
What I like about what you're saying is that hopefully people are listening to this and going, "Hey, I've dealt with this before, and this I'm not the only one, right? Other people have seen this, have felt this. You've seen this before. People are not anomalies or weird or broken because they have these
Right.
problems around consumption, you
Well, a lot
know?
of us have disordered eating, and maybe how can we not? Because every time we turn on the TV, open a magazine, turn on social media, there's a diet. What is the app? Groupon? I used
Mhm.
to look like cheap fighting how to get my nails done really cheap there. So I pulled it up, and every one of them was a different Ozempic or
Uh-huh.
injection to lose weight, and that's the latest thing now. And it's everywhere you go. So it's turned from let's do all protein to let's inject ourselves, and all our worries are going to go away. Now you're going to be healthy and you're going to be skinny, and life is going to be great. But you stop taking it, you gain your weight back,
That's how
right?
all the
So
diets work, right? Pretty much.
97% of diets fail.
It,
And that's why
it
it's one of the biggest industries, right? Because they know it's going to fail. That as soon as you stop the diet, you gain the weight back. Plus, because you've affected your metabolism in a way, now you're more. Now I got to find another diet that's going to work, and over and over and over. And that's also why people get bigger over their lifespan.
right. Kind of the yo-yo
Yeah.
they would say. Something else, that's pretty interesting, something that I've learned not that long ago is that United States is the only country that allows pharmaceutical companies to advertise on TV or on the radio or on billboards. And that kind of sets people up, right? We're just sending these messages over and over again and confirming those messages. We want to be aware
Or
of,
being
of
brainwashed.
it can definitely be problematic. You hear eating disorders discussed so much more frequently around girls,
Mhm.
around teenage girls or preteen girls. But at the same time, there are a lot of eating disorders in males. I know if you Google eating disorders, males versus females, you're going to see usually like 3 to 1 female to male. But from your experience in the years actually running treatment, do you see those same ratios or do you see it different?
I would say in my current program right now, 3 out of 10 are boys. It's occurring more, and I don't know if parents are wiser now and know what to look for. It's pretty shameful. It's a girl's disease. There's all these stigmas around it, right? Or boys are athletes, so that's why their heart rate's low. That's why their BMI is low, right? They're just a good athlete. So many times where a kid has anorexia or bulimia and they have a really low weight and a low blood pressure, the doctors just dismiss it and say you're fine, right? Or even
So the
praise
doctors
them
are contributing to that as well.
all the time. And granted, they don't have mandatory training for eating disorders. I think the last I checked, they had to get basically like 1 CEU or 2 CEUs in all their training in eating disorders. So the majority of them are not knowing. don't know the signs, don't think to even ask on a regular checkup of, tell me about how you eat.
Sure.
Maybe do a 24-hour recall. If I can think about any of the boys I have in my program now, they'll say, well, I go to the gym 3 hours a day, an hour in the morning, an hour in the afternoon, an hour in the evening. I eat 6 eggs for lunch and I do steak for dinner. And what might the doctor think of that? Would he praise them? Wow, that takes a lot of discipline. Or man, that seems kind of excessive for a 15-year-old boy.
Yeah.
Then you get his blood work done and his labs are crazy, right? You give him an EKG and he's got arrhythmias. And even then, we had a cardiologist argue with us just a couple of weeks ago, swearing that this kid was fine. We brought him into our program. He had a heart rate of 43, which you want to rush somebody to the hospital for that. And we
Sure.
did. We sent him to the hospital day one, even though the cardiologist swore up and down and pressured us for us to take him.
Really?
So, yeah.
So what happened in that situation? The cardiologist was saying 43 is normal for an athlete,
He's
and
totally
they
cleared to
didn't
come
want
to
to
your
look further.
program, which is my program's an outpatient program. They come 8 to 3 every day. It's not residential or hospital. My program, we don't have a medical doctor or a nurse on site because we have to make sure they're medically cleared first. They have to have
Sure.
more normal of a heart rhythm, good vitals, blood paneling that shows that there's nothing too off. And the reason why we want doctors to sign off is, one, so we're not liable if something happens. We don't want to take kids or adults that are sicker than we can treat.
So
Most of them don't want to go to residential. They would rather do my program, but it's unethical for me to take them if they're not well enough.
I'm curious, what we see is this disparity in males versus females in the eating disorder treatment. Do you think that the actual eating disorders is much more even and it's just not as much reported in males?
I don't know if it's going to be even, but I think the lack of reporting because of the stigma, because it's a girl's disease, because, whatever the reason, or they're misdiagnosed, not taken to the doctor misdiagnoses, that's probably more high for sure.
Mm. So more of a
Um,
misdiagnosis or an
yeah.
overlooked
Well,
or
there's
kind of
there's
your
praise for guys who are these super athletes, right? Look how dedicated you are to this diet you're on, and look how hard you're working out. It's different. You need to get bigger. You need to get leaner. You need to get stronger. So the pressure to look more like a man, so to speak,
Mhm.
is very strong. Or for a female, it's to get smaller. So different pressures, but can lead to the same
Absolutely.
result.
We saw something really interesting pretty recently. My middle son is 16 years old. He's on the wrestling team in high school. And when I was in high school, the wrestlers were losing 20, 30 pounds for a competition. And they would really restrict to get ready. And what they're doing now in the high schools, which I think I really praise them for this, is they're doing a weight a couple times a year that they're weighing the students, and you cannot compete in a category that's more than like 10%. There's a percentage in which you can't go above or below from this baseline weight to make sure
Mhm.
that kids are not just going out there starving themselves and then showing up to compete.
There's certain sports where you need to be a certain weight. So we see a lot of people who do crew and do sports where it's around that, not necessarily how you look, right? But you got to make this weight, and there's a lot of
Sure.
pressure in that. So I think any sport where you have to change your natural given body to be able to do certain things, is going to make you try to change your genetics. You're trying to change your biology. It'd
So,
be the same thing as somebody who's 6 feet tall trying to be a gymnast and
right.
shaming themselves for being that tall.
On our next episode, we're going to be talking about athletes and things for athletes to be looking at and parents of athletes to be looking at. Wrapping up the conversation on adolescents and parents and what we should be looking for and kind of how we should be communicating with our children. You mentioned some of the warning signs, some of the things to look at. How would you approach your child if you think that they may be at risk for having an eating disorder, or if you're kind of seeing some disordered behavior? What conversation do you have with your kids about that? And then how do you approach it kindly without judgment?
A lot of empathy and validation. So if you start to see your child reducing their food intake or taking out whole food groups, just to say, hey, I notice that the way you're eating is changing a little bit. Can you tell me about that? A bunch of my friends are trying to lose weight, so I'm going to do it with them. We're kind of doing it all together. Okay, it sounds like you're getting some peer pressure to do this, but
Sure.
let's talk about the effects that this is going to do to your body. So it usually starts off in some way that's what's happening in society, what's kind of normalized, and it's good to start to have a conversation around that. Sometimes it starts to happen the more the kids start to feed themselves and having less
Mm.
structure around food, and parents don't notice what the kids are eating, not eating, especially ages 13 up.
Right. They're more independent and potentially
Mhm.
not being looked over as much. We talked about all the places that people are potentially getting bad information. Do you have any recommendations of websites or places that people can go to get good information on eating disorders as a child or as a parent?
Well, I could tell you what not to do first is anything that talks about weight loss. There's also what people call pro-ana sites. So there's sites that tell you how to have an eating disorder, trick your treatment providers or trick your doctors. So there's a lot of stuff out there like that too. So really honing in on what you're searching for. So being aware of where your kids are getting the information from. So if they're looking to get more healthy, then we want to look at holistic, how to increase your energy, how to get more fruits and vegetables in your diet, things like that versus weight loss. And I think that's true for adults too. I have 3 teenagers. Every once in a while, I'm going through and seeing what they're watching on YouTube and TikTok, and just seeing what they're searching does all these algorithms. So what's popping up for them, and
So
just educating them on that.
what would you recommend in terms of how to find good treatment? Just like everything in this world, right? You're going to have the
Right?
good players and then you're going to have the bad.
National Eating Disorders Association or the Academy of Eating Disorders, they have some really good information. NEDA, the National Eating Disorder Association, actually has sites just for coaches, just for parents, for doctors. So a lot of resources, free support groups out in the areas, edreferral.com. So it's nationwide. They might even have international. So they'll have treatment centers, they'll have therapists, dietitians that specialize. A lot of people who might have eating disorders go to say, okay, I'm going to go see a dietitian. And the dietitian really only knows how to do weight loss or specific ways to, like, if you've got diabetes, how to help. It's actually the opposite advice of somebody who's a registered dietitian who specializes in eating disorders. Our framework is all foods fit, health at every size, right? So there's no shaming or blaming. You can be healthy eating all food groups. You can eat a Snickers bar. It's like none of that is going to make you unhealthy, right? Just like eating an apple doesn't make you healthy, eating a Snickers bar doesn't make you unhealthy.
Heather, this was great. I really appreciate you taking the
Thank
time
you
with
for
me to
having
go
me.
through this. And I'm looking forward to the next one for sure.
Absolutely.
Thanks for tuning in to Hatching Creativity. We appreciate your support. Please don't forget to like and subscribe and tell all your friends about the show. And remember, it's never just about one thing.